If you're wildly hypersensitive to medications or like completely immune to medications and you have EDS, POTS, or mast cell activation syndrome, listen, this is for you. Why is that happening? We notice that we get this a lot with a lot of neurodivergent patients who also have these comorbidities. Either they're like having a side effect to the lowest dose of like everything, or they're just like not responding, or it's just erratic, they're doing well, then they're not doing well. Medications are like very dependent on like, how is my GI system doing? It needs to be like stable. How's my liver doing? That needs to just be predictable. And then like some of them, like how's my blood-brain barrier doing? Which is kind of like the little gate it needs to pass through, and not everything is allowed to pass through there. It's very selective. And the thing is, like with blood flow up to the brain, blood flow in most of these things is compromised, right? There's a lot of variations that aren't in the typical person. And because of that, it causes like micro damages to the cells up there. And then you get the mast cell activation. And then that blood-brain barrier isn't as effective at keeping things out, and it might become a little bit leakier. It's letting shit in that it shouldn't, and it's letting shit out it shouldn't. With the GI component, we have a lot of like gastromotility problems. So like if that's not going well, then tablets aren't going to dissolve as they should, and capsules aren't going to be processed as they should. And then if you have a lot of inflammation going in your body all the time, then your liver is like it's a little busy. Your body's a little bit busy, and it's not breaking down the medications like it should. So that being said, like things with a long half-life might be adding up in your body and not coming out like they should. Your body might be like giving you like a sudden like boom of all the medication at once when it should be like spread out through time, or it just might not be hitting you when it should. Like the actual metabolism and like moving into your body and the pharmacokinetics are just fucked up. So even at lower dosages, you might be like, wow, I feel terrible, right? Like, how am I getting all of these side effects? These are the side effects of like the highest dose. So this actually isn't in your head, although your psychiatrist might be like, oh my God, why do they have a reaction to everything? This is so unusual. No, like this is actually a thing. Some of the safer medications for this, low-dose naltrexone, Seroquel, Buspar is okay. Lamictal is a good one. Hydroxyzine, especially for the mast cell, and mirtazapine, because it's got like a strong histamine component in it.